She was too weak to write, but she wanted to write goodbye letters to her family of 25 people or so.
Well, that was a nurse at Kootenai Health. She was one of several people to speak at a press conference today aimed at helping people understand what our hospitals are like right now.
North Idaho hospitals are still operating under crisis standards of care today amid the spike in COVID-19 hospitalizations. This comes as the number of coronavirus patients at Kootenai Health remains in the triple digits. Our own Ian Smay is live at Kootenai Health this afternoon with more on what healthcare workers are dealing with. Ian.
Tom, Mark, as of earlier today, Kootenai Health still had at least 108 COVID-19 patients, and of those, 33 are in critical care and 14 were on ventilators. Also, 9 patients are being treated in an overflow area set up in an area that's normally reserved for classrooms and conference spaces. And since August 25th, Kootenai Health says 87% of its COVID patients haven't been fully vaccinated. The situation here and throughout the region is causing a strain on the system. Leaders at Kootenai Health said there is still little ability to transfer patients, but one piece of good news from today is that Kootenai Health has been able to accept a few transfer patients this week from outside hospitals. Kootenai Health Chief of Staff Dr. Robert Scoggins said they are still admitting 10 to 15 new COVID-19 patients per day, and according to the nurses at Kootenai Health, the patients are people who say they didn't think the virus would cause them to need medical attention.
If they're able to talk, if they're not on a ventilator, a lot of them say, I didn't think that it would be me who's sitting in this bed. I thought it was either all political or all a hoax or just people who are in poor health or maybe don't take care of themselves as well who are getting this sick.
Kootenai Health does have about 70 people assisting with care as part of help from the federal government. They also expect that number to rise to about 111 in the near future. Another concern with the current situation is the cancellation of some important surgeries, causing further problems down the road. Now, Kootenai Health leaders also said that one piece of good news is that the use of monoclonal antibody treatments has helped keep some people out of the hospital and keep some of those beds free. Coming up at 5 and 6 o'clock tonight, I'll have more on what nurses are dealing with as they're caring for these patients and what this all could mean and how it could affect care for younger patients going forward. For now, reporting from Coeur d'Alene, Ian Smay, KREM 2 News.